My name is Eddy Perez. I'm one of the nursing faculty here at the FVI School of Nursing. Probably one of the most atypical instructors here because I am bivocational. I am a nurse practitioner. I hold a master in nursing, but also I have a master of divinity, and I'm one of the spiritual leaders here in South Florida. I am a pastor and work for the Lutheran congregation in town. I'm a foreign physician, went to medical school in Cuba, graduated in 1992, worked as a medical doctor for 8 years, and then came to the United States and became a nurse and later on a nurse practitioner. One of my passions is not only to see patients, but also to teach. And when we talk about teaching, my philosophy of teaching is that it's not only to pass information, but I believe that the teaching involves not only passing information, but also, and most important, to train and to equip the students. So if you are interested in nursing and you come to FVI, our professors here are not only going to pass information to you and test you in the information and train you to pass the NCLEX, which is the board examination, but also, and again, most important, you are going to be trained and you are going to be equipped to go and to get a job in one of the hospitals or maybe in other institutions and provide care for your patients. Right now I'm teaching foundations. Actually, I'm teaching Concepts 1. In our program, we call it Concepts 1, and it includes foundations and health assessment. These are two basic and very important classes in the nursing career, because if you look at the names, foundations or fundamentals are the basics of the nursing professions. There the student will learn how to approach a patient, how to go in and out of the patient's room, what to do, how to provide care properly for the patient. And then foundations go together with health assessment, and health assessment is paramount in the nursing profession, because you get to a patient and you have to assess the patient. In other words, you need to find out what's going on with the patient in order to make a nursing diagnosis, to write a plan, to do the interventions, and then to complete the evaluations. To any person who would like to become a nurse, my advice first is to think it through. Why do you want to become a nurse? Sometimes we want to do things, we don't know why we want to do things. So if you want to become a nurse, and it is because you want just to make money, think it again. However, if you have a passion to help people, if you have a passion to really care for people, that's a good reason to pursue a career in nursing. You want to know how is it? You want to know how the program is? I would advise you to call us, to call FVI School of Nursing, even to come by and request information and take a look at the program. Our program is probably one of the best programs in town. It is comprehensive. Students go to hospitals, go to healthcare facilities, practice, and as I said at the beginning, the student not only is trained on knowledge, it's not only, as I said at the beginning, student is not only prepared to take the board exam, the NCLEX, but most important, the student is here. The student is trained and equipped to go outside to get a job and to do it very well.